the station that's on your side. This is Channel 7 News Daybreak.
All right, welcome back, everybody. There's only 27 days left in fall, and today we are covering some of those fall allergies you may still get. Hey, what can trigger them and what to treat them with? Joining us now is Baptist Health Dr. David Gerson from the Sherwood Family Medical Center. Dr. Gerson, good to see you. Thank you, sir, for coming in.
Pleasure.
We know that it's getting close to the end of fall, and some rain, it might be helping some of those allergies today, or some of the things that can spark those allergies.
It can also kind of get them stirred up as well.
It's a double-edged sword. Now, you've got some things in here today. But before we get to the treatments, what are some of the triggers out there? What are things that people need to know that are causing?
Sure. So right now, the big deal is mold, ragweed, pigweed, and now we're going into the homes, we're getting our heaters are turned on, and so dust and dust mites. And so those are big as well. And so those are things we have to try to avoid. Okay.
And if you can, tell us about some of the remedies, some of the things that people can use to maybe alleviate some of these problems.
Sure.
What did you bring in today that might help?
Well, so, the big guns are basically the antihistamines. And so I brought in a couple actually generics. And that's one point I want to make is that with the allergy medicines, the generics in general are just as good as the name brands. And so you can save some money. You also can now get a lot of them over the counter without a prescription. Okay. And so the green one, that's our Zyrtec. The purple one, that's our Allegra. So these are the antihistamines, I think, they're the best for these kinds of allergies. Okay. And then your nasal steroids, your sprays. The very powerful ones, you still need a prescription, but you can still get a Flonase, which up until about a year ago was prescription. So you can get that over the counter. So nasal steroids, antihistamines, and then you don't need a prescription for these, just nasal saline. Squirting up in your nose and cleaning out all those allergens. That's going to be real helpful.
Lovely.
But the other big point to make is, if you know you have fall allergies, start treating yourself a couple weeks beforehand. So for ragweed and pigweed, I always tell my patients around August 15th, when you're not even thinking about it, get on the antihistamine, get on nasal steroid. You'll save yourself a lot of trouble.
Yeah, a lot of people have gone through those troubles throughout the year. And raking leaves also, I understand? That's something that everybody's doing right now.
Absolutely. And so those leaves actually have a lot of mold on them. And they're also carrying a lot of the old pollens from January and February when the trees were letting out their pollens. And so actually we get some, and so we'll still see that. And so right now we get a lot of patients that are coming in who think they have the flu, who think they have a sinus infection, and it's actually still allergies.
So what are the symptoms? If you think, because you think you have those symptoms of those obviously things that could make you sick for a week at a time.
Absolutely, or several weeks. So no fever, itchy eyes, runny nose, the pressure, ice picks in the forehead, in the cheeks here, even sometimes behind the ears. There's a sinus behind the ears a lot of people don't know about.
Really?
Scratchy, sore throat, waking up in the morning with a really dry, scratchy throat, that also can be with allergy.
Okay, well, for all those out there who suffer from fall allergies, hopefully the end is in sight for you, and the 27 days left of fall, so it should happen sooner rather than later. And if you've been dealing with them, maybe some of these over-the-counter medications that we talked about today can help alleviate that final stretch of pain. Dr. Gerson, as always, thanks for coming in. Hey, you can always contact the Baptist Health Center by calling the Baptist Health Line at the number on your screen.